down, then it actually not think that it's not possible to shape. It is possible to shape, but it will take time. It will give some extra work for the dentist to do these things. The materials are supplied in the kit that include the varying shades of the composite resin along with the etching and bonding system. And each and every single company, they have their own materials. So it is wise decision to use the same materials, bonding and the etching system if we want to apply the composite filling materials. If you use the etching and bonding, different company and different company composite filling materials, that will not a good choice. So that's why you will see in the dental clinic they use the same companies, all these things like the if the etching, bonding and materials, it should be the from same company. That will make some proper integrations of the work. As you can see here, that is the way usually polymerizations takes place. So process by which the resin materials is changed, that is called the polymerizations. Very important to memorize this word, polymerizations. So a question will come like that: in which reactions composite resins are going to be, the soft to hard enough or permeable to a hard stage? Answer is polymerizations. It occurs to the auto cure or the light cure depending on the nature of the materials. So these are the exact curing time depends on. Number one is composite manufacturing instructions. So whenever we use the dental materials, no matter whether it is filling materials or the impression materials or the model materials, we always need to focus the manufacturer instructions, because manufacturer, they will give us a source of guideline which way they want their materials to be used. So if we buy the materials and we just mix by our own, or we try to apply it in the patient's mouth by our own desire and own decisions, that is absolutely wrong idea. We have to use the materials on the base of the manufacturer instructions. That's number one. Number two is the thickness and the size of the restorations, because it is better to apply by increment, 1 millimeter at a time, 1 millimeter at a time. But if it is, the large cavity, we can go like that. If a small cavity, we can go for maximum 1 millimeter thickness at a time. So according to the new advancement of the materials, maximum 4 millimeter we can add at a time. But it is better to use the millimeter by millimeter. That's why you will see the dentist, when they apply the composite filling materials, they also apply it by increment. And the shade of the restoration materials is used also play an important role for the curing or the curing of the material. So one is the manufacturing instructions, one is the thickness, and another one is the shade of the restorative materials. These are all about the prerequisite for the materials to be polymerized. Now, what are the steps in the finishing of the composite filling materials? So as I mentioned that it is very difficult when it is cured to adapting. So that's why all the time we will adapt it first. We will do our carving and then we go for the curing. So reduction of the materials is one of the main reason when the composite are come up with the polymerized shrinkage, because polymerizing shrinkage is one of the very common problem. Till now, no company is saying that their material not shrink. Shrink means when you give the material this size, after curing, they will be short like that. They will be spot like that. So when they shrink, they'll make the micro gap. And that micro gap will be the harbor for the microorganism. That's why the recurrent caries is very common in case of the composite filling materials. What do you mean by recurrent caries? Anybody in the class? What is the meaning of recurrent caries? What is the location of recurrent caries?
Formation of decay, I mean the caries on the restoration.
Under the restorations.
Yeah.
Yeah, so the formation of the caries under the restorations, that is actually a recurrent caries. So it means that how it is formed. So a tooth come up with a cavity, and the patients go to the dental office. So they remove the disease part and they put the materials. That is the prerequisite. So to give the filling. But we are saying that that is not able to secure the tooth to be further going for another carious attack. The reason is during the removing of the disease part, if there is any negligency from the dentist point of view, if dentist is not properly remove the disease part, that can be the one of the reason the patient maybe end up with the caries again the same teeth. Second point is if the materials is shrink, because materials will shrink, so dentists need to come up with a technique which is called the increment by increment or the diagonal technique, so that they can minimize the shrinkage. If they are not able to minimize their shrinking capability during the procedures, then the secondary caries or recurrent caries will be come up. So that's why the polishing of the resin begins with the at the end of the curing procedures. It can be come up with a coarse, medium, fine, and the super fine. So these are the steps, because the composite filling need to be very smooth, because by nature the materials become rough. So we need to make the surface smooth. If you look at our teeth, which has no filling, by nature or naturally, our teeth surfaces become very smooth. Okay, if there is any rough surface, that means it is called that due to the demineralizations. But the composite filling materials, they are the plastic materials. So once we apply these materials on the tooth surfaces, we have to make sure that their surface should be as smooth as the surface of the original tooth surfaces. So that's why polishing is very important. So polishing with the resin materials, we can begin with a different type of disc. It can be the the carbide or finishing birds or dental birds or the diamond birds that can be used. The birds we'll talk about in our next class. So these instruments, which is very commonly we use for finishing the the labial or the buccal or the lingual surface of the restorations. And sometimes we use some finishing strips. So the finishing strips we use for the interproximal surfaces to finish the tooth surfaces. And the last of all, a polishing paste can be used with the rubber cup materials, so that it can be help us to smooth the tooth surfaces. I think that is pretty much all about the composite filling material. So I'm going to stop here. I'm giving you some room for all of you so that you can study by yourself. And that tomorrow we will continue other materials like the glass ionomer and indirect restorative materials. So basically, today we talk about three things. Number one, we talked about the basics about the dental materials, how a dental material should be, what are the in general properties has to be present in a dental materials, or what are the in general properties need to be present in the materials so that they can be used as the dental materials. Second point is we talk about some examples of the direct restorative materials. And out of these 5 direct restorative materials, we talked individually 2 dental materials. One is the amalgam, which is considered as a metal restorations, and another one is the composite, which is used as a the plastic dental materials. And we also try to compare these 2 materials together so that we can understand what is the difference between these 2 materials. Okay, so please study these 2 materials and as well as the basics of the dental materials. And tomorrow we're going to talk about the glass ionomer and as well as the IRM and what do you call ceramic materials. Okay, any questions from anybody? Please go ahead.
Sir, I have a question.
Go ahead.
Do we have any exams or labs on July 8th?
July 8th.
Yeah, I have an appointment to book.
I can't say anything right now because I don't see anything in front of me right now. It's impossible to me to tell you about the July 8th. But July 8th, that is a Wednesday, right?
Yeah, it's a Wednesday.
July 8th, I can't say anything right now.
Okay.
Yeah, I don't have anything in front of me.
Okay.
Sorry. I just want to confirm that on Monday we have only practical tests, right? It's not like written questions or something.
We have practical and as well as we have exam.
Is it the final exam for this course?
Which course is final exam? What are you talking about?
I mean the one that we started today.
Yeah, so on 29th of Monday, I think I cleared it before. Maybe you missed this informations. So whatever I showed you yesterday, that is the practical competency for the pharmacology.
Yeah.
So your previous module, pharmacology modules, assignment is done. Then your final exam is already done. So which I am on the way to process to see, and your practical is not done yet. All of your practical is not done yet. So your practical final exam regarding the pharmacology module, which will be held on 29th of June, that is next Monday. And after the exam, we will do some practical, that is the mixing of the alginate materials. And regarding the alginate materials, we'll talk about on Friday.
Okay, gotcha. Okay. Thank you.
Okay, is it clear for everybody? So you have exam on 29. Keep in mind, on 29, when you're coming in the college, you will be called one by one. We'll call you one by one to show you at least the 3 injection site, and also we will ask you about what are the component parts of the aspirating syringe, component part of the cartridges, and how to assemble the cartridge and the needle into a aspirating syringe. And you need to achieve 70% mark out of 100 because that is the requirement to pass the module. Okay?
Okay.
Sorry, can you repeat it again, please?
Which one you want me to repeat it again?
The question that we did on the practical exam.
You didn't do any practical. I showed you some practical demonstration yesterday, right? So that thing will be
Yes.
evaluated you on next Monday. And at the same time, we will also do some practical competency about the materials. Okay? So please make sure that you guys study about the injection sites and as well as the parts of the aspirating syringe and the cartridge and the needle. Is it clear now?
Sir, just exam is practical, right? We don't need to bring our computer.
No, you don't need to bring your computer.
Okay, thank you.
Okay, anything else?
And when is the final exam for dental material?
It's not decided yet.
Oh, okay.
Anything else? Okay, so thank you very much, and please study and enjoy your time. Thank you.
Sir, do we have any quizzes for this course?
We have quiz and we will let you know tomorrow because the quiz, final exams, practical final, everything will be decided by today and you will know by tomorrow.
Okay, thank you.
Thank you.
Thank you. Thank you very much. Bye-bye. Take
Thank
care.
you, sir.
Hey, teacher.
Thank you. Bye.
Thank you. Bye.
Have a good day. Bye.